Okay, it's 2:15, and our next committee of the day is the Public Safety Committee. Again, those committee members are Kamer, Mosley, Lombardo, Malik, and McKittrick. We do have all committee members present whenever you're ready, Mr. Chair.
Thank you, Sarah. I'd like to call the Public Safety meeting to order, please. Can I get approval of our minutes, please?
So moved.
Second.
All in favor, aye?
Aye.
Aye. Anybody opposed? All right, thanks. We do have one resolution in front of us today, and we also have a presentation from Chief NACO. Resolution, Sarah, could you read that in, please?
Sure. Item number 14 is offered by McKittrick. It's a resolution opposing and objecting to the transfer application of B&C Akron Enterprises LTD, doing business as Brandy's Sports Bar, 1890 South Arlington Street, Akron, Ohio, 44306, for a Class D1, D3, and D3A liquor permit, 0346772, now pending before the Division of Liquor Control and declaring an emergency.
Thank you, Sarah. I appreciate that. And I do see our Chief Prosecutor, Mr. Morgan, with us today. Please.
Thank you, sir. Members of council, the property in question has a history here in the city. Mr. McKittrick's predecessor was forced to object to the previous permit. We were successful in that objection. The property is uniquely situated just at a southern border there on Arlington Street, but it has an existing permit premise next to it, which has an excellent record in the city, along with an apartment complex, a residential unit across from it. The property in question had a long history of being utilized as a adult entertainment location, as well as after hours. And then once their permit was gone, it turned into illegal sales. There was also issues with drugs and violence. The current situation is this: the new ownership contingent appears to be a limited liability partnership owned by a limited liability company, and as you start to go down the rabbit hole, there doesn't seem to be a lot of accountability here, which raises some serious concerns. Myself and Councilman McKittrick have talked about it. They already appear to be hosting events, and they don't have an active permit, and they're also advertising for dancers. So based on all of that, this is a transfer application. It's not our annual renewals. And the transfer application, the objection to that is due on August 11th. That's why we wanted to get here before our break. So I can certainly answer additional questions about the property. The resolution, if passed, would simply trigger the hearing with the Division of Liquor Control at the local level and at least get a conversation started about what Mr. McKittrick and his constituents expect for the use of the property going forward.
Thank you. Councilman McKittrick, anything to add?
Not really, but I am kind of surprised that they have had 2 events so far, and it kind of evolved from being Brandy's Sports Bar to Brandy's Pub, and the most recent post on social media listed as Brandy's Gentlemen's Club. And they are having an event tonight that's listed to go from 8 p.m. to 2:30 a.m. And they are advertising for upscale dancers. So, thank you.
Thank you. Any committee members or council members? Councilwoman Mosley.
Thank you, Mr. Kamer. Craig, is there a way that, you may already be doing it, we just don't know about it, if we could put together some kind of Excel sheet, some kind of tracking mechanism when they're doing these transfers, because it's happening all over the city, and they're transferring them back and forth between friends, cousins, relatives, whomever, and we always end up right back here having the same conversations. Same people, just different names, and they're moving them back and forth. If there's a way so we can track them so when these things happen.
Absolutely. As with the transfers, they can occur anytime during the year. Our annual renewals always take place in October. That's why we're here before the break to get any objections in. The transfers and new applications can occur any time of the year. We can certainly track them. I will tell you from the past, and I know you remember some of the names, they have gone by the wayside. We did put enough pressure to get some individuals to drop out, but certainly that doesn't mean that there aren't some individuals willing to step up, because just at a cursory level of review, I doubt that the people holding these limited partnerships and the limited liability company have any operational involvement in the property. So absolutely, that's something we can certainly do. I think the old guard has left, but we should certainly keep track of the new guard.
Right, okay, thank you.
Thank you. Anyone else? Any other council members? Obviously, this is our last meeting until September, so I guess suspension of the rules.
So
I'll make that motion.
I'll second it.
All right, I have a motion and a second. All in favor? Aye. Anybody opposed? All right, thank you. Well, Craig, I appreciate all your hard work. Hope to see you tomorrow.
Thank you.
Night out.
Thank you, sir. I'll see you then.
I'll see it. All right, moving forward, I do see Chief Napko, and I would like to turn it over to him so he can present to City Council, and then when we move forward to take any questions or comments, I'll start with committee members first. Chief?
Thank you, council members. Councilman Kamer, how long do I have here? This could go on for a while, or I could make it short.
I guess we'll just move forward and we'll stop when there's time to stop, and Sarah will help us guide us in that direction.
All right, Sarah, don't bring out the hook, all right? Just give me a minute. Today is the last day that we are utilizing the private ambulance service, AMR, to assist with Akron Fire's EMS transports to the hospital. And it's been a long-standing relationship we've had with AMR, and this will be the end of it. They are pulling out of the city, and there will be no more resource for us past midnight tonight. The backdrop for it is that AMR provides non-emergency transports for us from the field into the hospital. So our paramedics and our ambulances will go out into the field based on a 911 call, assess a patient, stabilize a patient, and if that patient needs to go to the hospital but is non-emergent, then we would call AMR to the scene and hand over patient care, and AMR would then complete the transport and go on into the hospital. Akron Fire has always transported the emergent patient, the serious patient. We've always transported that patient in the hospital, and we will continue to, along with now the non-emergent patient. To give you a scope of that volume, last year, roughly, we sent 25,000 people to the hospital. That's out of about 50,000 calls for the entire year. We sent 25,000 to the hospital, 12,000 of those Akron Fire transported, and approximately 13,000 AMR transported for us once we turned over care to them. So whereas our run volume is not increasing, the amount of time we are occupied on a run is increasing exponentially. We are doubling up, if not more so, on the number of patients we take into the hospital. And that presents quite a few challenges for us, and we've been preparing for those challenges here over the last few months. The number one challenge is staffing. We have to have the staff in order to complete these transports. So up until today, what we've done, we've operated on a model where not every one of our units would stand alone. We operated on what's called a combo model, where some of our units, an engine and a med unit, would be comboed. So the folks that would respond to a scene would either jump on one truck or the other. If they jumped on an ambulance to go to a scene, the fire truck would be out of service back at the station. If they took a fire truck to go out to a fire call, an ambulance would sit back at the station out of service. Starting tonight at midnight, we've moved up our staffing with the use of overtime where every unit stands alone. We are not operating by the combo model. And the goal with that is that we have so many ambulance calls that will be occupied with transporting patients that our engines and our ladders will still be available to the citizens of Akron. We're trying to combat, what we're trying to do to compensate for the lack of staffing is, number one, overtime. That is a short-term fix. It is not a good fix. It's not a way to operate an organization. It's hard on our folks. It's extremely hard on our folks, physically, mentally, emotionally, and we recognize that. But we're adapting by using that for now. The long-term fix is additional staffing. We're moving towards additional staffing with the hiring process. We've placed a hiring test. We've got folks on a list, and we are now moving towards getting those folks hired. But for any of you that have followed what it takes to hire a firefighter or a police officer, it's a very elaborate, extensive process. There's background checks, there's polygraph checks, there's ability testing, there's drug testing. The background checks alone take up to 2 weeks, and it's very exhausting. We're in the process of doing that right now. Once we hire those folks, we got to bring them on, and we have to train them. Once we train them, we can turn them loose in the field to work as firefighters. That is just as a firefighter. That does not mean they are paramedics. Going to paramedic school takes an additional amount of time. We hope to have firefighters trained and available to put out on the line by November, about that time frame. We hope to start a class early September, move them through their fire class, and then have them available maybe November, maybe even early December, so they're available on the line. Those are just firefighters. They are not paramedics. We would then take those folks who don't have paramedic training, and we would send them on to paramedic school, which takes an additional 10 months of training. We send them to the local hospitals who have paramedic schools. That's SUMA and Akron General. And that, again, that takes some time. It takes an expense, but we're moving forward with that plan as well. The staffing, we will hire, we've bumped up our staffing, where we are now, with finances approval, allotted to almost 400 firefighters. Those will also be paramedics once we have them trained. That is 25 over what we are currently allotted, which was what we need. Our new magic number is 396. We don't know if that will compensate for the additional workload or not. We are anticipating that it will, but we don't know what we don't know. We've never had to do this before, absorb this additional workload, and that is what we're walking into tomorrow, is absorbing this additional workload. Some of the additional things that we've done to try and compensate for this additional workload, adding additional med units. So our operating model up to now has been 13 frontline med units. We're in the process of adding 3 new med units, so it changes our operating model to having 16 frontline med units. We've already done that with 1. We've added 1 additional med unit, put them in service at Station 6. They're known now as Medic 6-2. So we are operating with 14. The additional 2 med units are going to take a little bit of work. They're going to take staffing. That's one thing that we don't have. They will take the addition of the equipment. Right now, an ambulance has a 2-year lead time on it. Ambulances that we ordered in 2022 to replace some of our fleet will not come in until 2024. What we will do is reprioritize those to not replace our frontline fleet, but to be in addition to our frontline fleet. So we end up with 3 additional med units overall 16. A cost of a new med unit is $250,000. You put all the equipment on it, it's $325,000 to $350,000. And the equipment is very extensive: cardiac monitors, cot loading systems, chest compression devices, all the drugs and airway equipment that we carry. Some of the other things that we're doing to try and compensate for this. We're now, for the first time ever, talking about stacking low acuity calls. That means we do not respond to a low acuity call when we've got and we've dropped down to a minimum number of ambulances available. So in other words, if I have 14 ambulances in service today, and I have 12 of those ambulances occupied out taking care of people, we would then start stacking the low acuity calls until we have more ambulances in service and available to go. We've never done that before. It's a new concept for Akron, it's a new concept for our dispatch center, and we're all struggling to come to grips with it. But it's what we're prepared to do. One of our biggest anxiety pieces is that our folks will get locked up at the hospitals. It's been a long time issue. We've been constantly negotiating with the hospitals and discussing with the hospitals the fact that our folks cannot wait at the hospitals. Our staff, our personnel, incredibly resilient. They're up to the challenge of the additional transports. Everybody is game on, they're ready for it. What they can't control, nor can we control, is when they get into that hospital, if the hospitals will not take patient care from us and release us back out into the city. That is the difficult piece of it. We've struggled with this in the past where our ambulances have waited more than an hour at a hospital. Last week, 2 weeks ago, I'm sorry, one of our ambulances waited 3 hours at a hospital. Hospitals have all kinds of contingency plans to try and combat this, but it still remains an issue for us at the hospitals. And we continue to talk to them about what's called our offload policies, our offload wait times. It continues to be an issue. We continue to deal with it. But as you can well imagine, we can't have 13, 14, 15, 16 ambulances locked up at the hospitals. That will shut down our EMS operations totally. We have no one to rely on except for, beyond that, mutual aid, calling in cities from outside of our city of Akron. Some will come, some will not. We're at their mercy at that point in time. We will respond to engines and ladders as a first responder. They have basic equipment on them to kind of stabilize a patient if our ambulances do get all tied up at the hospitals. But then those engines and ladders that are out there taking care of a patient are not available for the fire call that's right around the corner. It's an incredibly complex problem we have. There was a Beacon Journal article on this whole situation online today. It explained it very well to the civilian population out there. I don't know how in-depth people will look at it, but it really laid it out there for us, and I appreciate the Beacon's time in understanding our problem. They really went in depth, and they talked to me for several hours on it. We've always had an outreach process where we've sent a team out into the field before the 911 call to try and eliminate some of these issues. If we find that somebody is a frequent caller or they fall a lot, we send a team out there to try and correct the situation for them. Some folks, that's all they know to do is to call 911. They use us as their primary care service, and we always go. We always take care of the situation. We always have, and we will continue to try. We will continue with the outreach program, and we hope to grow it. But again, it takes staffing. We're working with the police department at this time for what's called a mobile crisis unit. Instead of sending an ambulance and a police car out to evaluate a psychiatric call, which ties up a huge amount of resources, we hope to send a team out in an SUV type of vehicle that consists of one paramedic, one police officer, and one mental health worker. Someone to take care of that psychiatric patient, to help that psychiatric patient get into further care, to just form the bridge that sometimes they need to step away from the system a little bit. It's not up and floating yet, but we've got the cooperation of ADM. I've been in contact with Amy Wade quite a bit over this program. She's all in. They'll provide the social worker. They'll provide the mental health worker. They'll also provide the vehicle. We just need to put the bodies on there. These are some of the things we're doing to try and reduce the call volume. It won't be but a drop in the bucket, but it is some of the things we're trying to do to stop the 911 calls before they come in. The mobile crisis unit, as I've explained it, will go out as a pilot program here maybe over the next couple months once we get everything in place, and we just have to see how it goes. We've got 3,000 to 3,500 psychiatric calls in the city over a year's period. That roughly averages about 10 calls per day. 10 calls per day that Akron Fire goes out on, Akron Police go out on. Again, an exhaustive amount of resources tied up with one individual. Most of these are nonviolent, just looking for some help. The violent ones will take another response, a different type of response, more personnel on scene. But the nonviolent psychiatric patient, again, that 3,000 to 3,500 calls per year, we again hope to put a dent in that. So these are just some of the things we're working on. Here for the next couple weeks, we are at maximum staffing using overtime. Again, that overtime model can't go on forever. We will potentially outrun our overtime budget for the year, and if that's the case, I'll come knocking at the door here looking for more available funds to support that overtime budget. A lot of this is predicated on when I can get a class, what certifications those folks that are in class have, and how quickly I can put them on the line. But everybody, all of my staff is moving towards that goal quite strongly right now. So that's a lot, and it's a lot in a small time, in a small package. Do you have any other questions? Do you have any questions for me?
Thank you, Chief. We'll start with Councilman Malik, then we'll move forward.
Thank you, Mr. Chair. Thank you very much, Chief. And thank you really to every single member of our fire department who's bearing the brunt of this. I know we talked a lot about this in the budget hearing, but to be at this point, I think is sobering, and I hear the tone in your voice, it's very sobering. Just a couple questions. So right now, how many of our firefighters have a paramedic certification?
153.
Okay. And what number would you like that to be at?
My goal, long-term, would be for the entire department to be at the paramedic certification level. I've talked about it before. I've talked about it before with labor relations and with our union. And the term is medic for life. Most municipalities around us exercise that way, where somebody, once they are hired on, they stay a paramedic for their entire career. It does two things. The rotations on from the med unit to the engine, back and forth, it becomes much easier. Instead of our 153 medics being on that ambulance every single day and just getting they're just getting destroyed. It would give them a rotation onto a straight fire company, a straight fire engine, where they may have one day on an ambulance, one day on an engine. Something like that. It's a break, it's a rotation. But it's a contractual thing that we have to work with the union on, and with the city on as well. So we would greatly love to move in that direction.
Thank you. I know we had, a number of people who work for AMR, and those people are now trying to, either find employment here in other communities. Have we reached out to some of those folks and see if any of them have, obviously, if they need to go to school, it's not going to help us immediately, but some of them may have a fire or paramedic certification. Have we reached out to any of them?
We did, but it was through the testing process, through a recruitment process. So in order to be employed by the fire department, you have to go through that civil service type of test and rank high enough on the list to then get considered beyond that. We took the top 150 that was on that list and started into the process back in March, where we put them through what's called our ability testing. That top 150 intelligent people had a lot of certifications, but now we got to see if they can get through the ability testing. After the ability testing, they have to pass the polygraph testing and the background checks. So what you're talking about, Councilman, sounds a lot like lateral transfers.
That was going to be my next question, Chief.
And lateral transfers are something that I've posed the question to HR. How can we, the fire department, move into the lateral transfer arena? So my goal here would be somebody who has worked as a firefighter and a medic in another community, probably another municipality, if we could move them into our organization, what that would take. Do they have to go through that testing process? I would still want them to go through background checks and polygraph checks, so we vet them as thorough as we do. We only want the best of the best. But do we have to wait for them to go through a civil service test and everything that it takes there? So I've started the conversation with HR on lateral transfers.
Thank you. And thank you for answering a question I was about to ask. I think, I'm sure others have questions. I guess the final point I would make, and maybe to our committee chair, is maybe it would be possible to invite you back, maybe at our first meeting back in September, and see where things are a month in. I think particularly really, as I was reading the Beacon Journal article, I was interested in seeing over this next month, how many times do we wait longer than half an hour at a hospital? How many times do we wait over an hour at a hospital? Because I know that's something that has been an ongoing issue. But that would be my request for our committee chairs, that we circle back on this in September and make sure that we're, as council, keeping a close eye on this. And again, just thank you to all of our paramedics and all of our firefighters.
Thank you, Councilman. Councilwoman Mosley, and I think President Somerville is next.
Thank you, Chairman Kamer. Chief, just a few questions piggybacking off what Councilman Malik proposed with the lateral transfers, and seeing how maybe they can almost expedite that, seeing that you guys are in crisis mode right now, I think would be imperative to help ease this burden that's coming. So anything we can do on our end to support that, I'm sure we all would. Secondly, when we talk about AMR pulling out of Akron, are the other municipalities like Cuyahoga Falls, what paramedic response services are they using? Are they using AMR as well?
No, ma'am. Most municipalities do not rely on a private contractor such as we have been. It's been a part of our operating model since
Forever.
before I came on the job.
Yeah.
So I'm so used to it, and then to look outside of our organization and see folks that don't use that has been really kind of eye-opening. So they do not. They rely on their own, and they rely a lot on mutual aid, and we've already got some rumbles about mutual aid, because they sense that we're going to call.
Yeah.
And
Yeah.
their neighboring communities sense that they won't be available for them anymore because they're coming to us. It's funny the way the ripple effect happens
Yeah.
with a lot of these communities now looking at us because they're concerned about our run volume. We're going to try some innovative new things here coming up to try and put more folks on the workforce sooner. When our background process is done, when our polygraphs are done, when we vetted our people to the extent that we think we need to vet somebody, if they've got a paramedic certification, my goal is to hire them, bring them on, put them out on the line working as paramedics for us, and then later on down the road, put them into fire school so they then have the additional fire certification. We've never done that before. We've always gone through hiring a group, putting them through fire school, regardless of their certifications, putting them through fire school, and then taking them out to the line so they are full-fledged firefighters, maybe lacking the EMS training, but they have the fire certification. I'm going to flip that. If they have the EMS certification, the paramedic certification, I'm going to look towards moving them out to the line as soon as possible, and then sending them to fire school down the road. I can't use them as firefighters right away, but right now I need paramedics. And it's different. it's backwards from what we've done, but we think it'll work. We think we can do it. Right now, I have to wait and see what that background vetting process yields for me. Maybe the top 20 people, maybe 10 of them have a paramedic card and 10 of them don't. And those 10 would be the 10 I would choose to bring out to the line right away. I have to wait and see what that yields.
So my final two questions is, speaking to what you just spoke of, is the time frame. If they have to get a background check and a polygraph test, how long of a process, if they already have their paramedic EMS certification from another municipality and you're able to circumvent all the other processes through civil service, how much more time would be needed for the background and for the polygraph in order for them to come on to provide a service to the city?
Part of that is driven by how many folks we have doing backgrounds. So we take on the background check process ourselves. We take folks off the line and put them into a background process. And that's a double-edged sword there. If I'm pulling them off the line, I don't have those resources on the line, and I'm using them to do backgrounds. Right now, we have 8 folks doing backgrounds for us, 40 hours a week plus. We're paying them overtime to get the backgrounds done, as a matter of fact, to get them done sooner. We're almost up to 20 completed backgrounds, and that's my goal, is I will move forward once I have that number of 20 to see what I have, what I can net out of that. It takes about 2 weeks to do a background and polygraph and completely get somebody checked out. Our folks are, when our background investigators are doing this, they're out knocking on neighbors' doors, they're talking to employers, they're interviewing the people. Some folks are very forthcoming with all the information. Other folks, it's not as easy a task, so everybody's a little different on their response. So if I were to put 20 background investigators into the process, that turnaround time would double, but it's at a balance.
Right. And the final question, you spoke of possibly having all the firefighters certified. Would they become certified through the city's program, or would they have to go to like SUMA or Cleveland Clinic to get their certification? You said you have 153 that are certified right now. In order to bring all the other ones online to offset that, how much time are you thinking that would take?
So the folks that we hire that don't have the paramedic certification?
Right.
The folks that we hire that don't have a paramedic certification, the programs only run in a certain time span. So the Akron General program, for instance, it starts class late August and it goes for 10 months. They won't graduate until June of next year. The SUMA program starts class January 1st, and they won't be available, they won't be done until October of next year. So it depends on the availability, what's open in the class. The classes can only house so many students at one time, and they usually give us a priority because we're good for them. We're good business. Our students are good students, but they won't bump other folks to put our folks in if they've already got something going. So, in other words, the Akron General class starts at the end of August. They're set. They have their students. We can't put any new folks in there that we don't already have in there. So new hires, we can't put them into that program. The SUMA program that's going to start in
November.
January.
Yeah, they're taking applications till November.
We can. That's right. The application process starts early. I don't know if anybody from this particular hiring, if I could even get them into the SUMA program.
Right.
I know we'll look hard at it. For the first time ever, we've talked to Akron General has worked with us in opening a second program. They only ran one program at a time. Because of our requests, they're going to now open a second program, and they'll run 2 programs, a day and a night school. They've never done that, but they've done that because we asked them to. We started talking with Stark State, who has a paramedic program. We've never worked with them before, but we think that they will work with us, and we're open to their program. So
So Stark State has a program, and if you're a city employee, you can go to Stark State for free. So we'd hope that they could add something, especially if they're already employees of the city.
I've already been down that road, and they won't do it for that. They will only do it for accredited college-type classes, not any of the trade schools like paramedic school or CDL or any of that. They won't do that for us for free.
Okay,
I
thank you.
knocked on that door already.
All right, thank you, Chief.
Yes, ma'am.
Thank you. I have in order here President Somerville, Councilwoman Howland, and then Councilwoman Mobian. So President Somerville.
Thank you, Mr. Chair, but Chief already addressed my question, so thank you.
Thank you, President. Councilwoman Howland.
Thank you, Mr. Chair, and thank you, Chief. Very thorough presentation. I pick up on and I very much share your anxiety about what we're in for, especially in the initial transition. One of the things I think we find out over and over again these days is that unfortunately few really do follow the news from traditional news sources. And I'm sure you've already thought of this, but I'm going to urge and put my money where my mouth is too, that everybody involved with the government of the city of Akron is here for you in terms of getting this information out. But I would suggest that if it hasn't already happened, assisted living facilities, nursing homes, AMHA facilities, universities, that anybody who represents a significant customer to the AMR service historically probably needs to get a really specific notification like yesterday. The AMR situation is really, it's a symptom. Our national medical care situation has failed us. We do have, and you pointed it out early on in your presentation, we do have a problem, and that we have so many residents who look to emergency rooms and first responders as their primary care, medical care source. But we can't really expect a sudden gear switching here if we don't provide the information and an alternative way to go. The other thing I wanted to throw out here, and this may seem like the most random thing in the world, but there are an extraordinary number, like in the hundreds and hundreds, of locally trained EMTB paramedics who serve as ski patrollers. It wouldn't be a bad idea to make a few phone calls to area ski resorts to look for new recruits. These folks carry active EMT A and B certification. Not a bad idea. And in the meantime, I hope that there are a lot of people who will watch this presentation and spread the word that we have a different system now. And thank you so much, and I wish you well in the coming weeks. I look forward to hopefully good news in September.
Thank you. Thank you.
Councilwoman Mobian.
Thank you, Mr. Chair. Thank you for the presentation. Just curious, how many mental health incidents or referrals would you estimate that you receive? I know you said you've already talked to Amy Wade, and I think you already know that the Data Board is talking about a crisis system of some kind. And somehow I think our officers, probably both police and firemen, were kind of involved in helping them develop what they were talking about. But with your shortage of resources, I'm not really sure how much help you're going to be to the Adam Board. But what are you looking at in terms of approximately how many mental health situations you run into?
I don't know beyond the numbers that we see right now, where, like I quoted earlier, about 10 per day mental health calls is what we see on average, 3,000 to 3,500 a year, and that number continues to rise all the time. The program that we're proposing, which would be a pilot program, could only grow if it's successful. Right now, we're talking about this mobile crisis unit going out on a 40-hour schedule, so we can monitor their success, so we can put the right folks on this unit. We've already got some folks who have volunteered to be on this unit. If it's successful and it goes well, then we start talking with ADM, Amy Wade, about possibly a second unit and putting this tool that we would have out there 24 hours a day, 7 days a week. But it comes at a cost to them, ADM, because it's a salary for a mental health worker right now. It's a vehicle that they are supplying for us, and if it were to grow, we could easily put 2 or more of these units out there every day, 24 hours a day, and they would be busy. Did I answer your question?
Yes. Are you taking most of these residents to PES or to the ERs?
A combination of both. We've been working very closely with PES on this, hoping to take a good majority of our patients to PES, but then again, it depends upon their volume, whether they have room for these patients. So we consider ourselves able to medically clear the patient so they can go to PES, and that's been kind of a difficult piece to navigate. But we consider ourselves able to do that. If we medically clear them, where all they have is a psychological issue, we can take them to PES, and we are working towards that goal right now with them. But the ones that can't go there, then we would most likely have to take them to the hospitals right now until another community resource opens, another place for them to go to.
Okay. Thank you very much. We certainly wish you well in this unusual endeavor.
Thank you.
Thank you. Thanks, everyone. Chief, I appreciate the hard work, and tell everybody they have our support.
Yes, sir, and I took a couple notes, so I'll be ready to come back here in September and tell you how it's going.
Thank you, I appreciate that. With that, I do see we have budget and finance behind us, so nothing further, we are adjourned.
Our next committee of the day will be the Budget and Finance Committee. It will begin at 3 o'clock. Those committee members are Freeman, Amobian, Malik, Baylor, and Lombardo. Again, that's the Budget and Finance Committee, and it will begin in just a few minutes here at 3 o'clock. Thank you. Okay, it's 3 o'clock, and our next committee is the Budget and Finance Committee. Those committee members again are Freeman, Amobian, Malik, Baylor, and Lombardo. We do have all committee members present whenever you're ready, Mr. Chair.
Okay, thank you, Ms. Viviano. We will call Budget and Finance Committee meeting to order. For the record, we do have all members present, and if I could have a motion from one of the committee members to approve the minutes from the last meeting, please.
So moved. Second.
Have a motion and a second. All in favor, please let me know by saying aye.
Aye.
Any opposed? Okay, thank you so much. All right, we have a few items to come before us today. The first is an ordinance authorizing the mayor or his designee to enter into a contracts without the formality of advertising for bids with Sikich LLP for the purchase of virtual CIO services for the Information Technology Division and declaring an emergency.
Thank you, Mr. Chairman. So this is a renewal of our contract with Sikich. We've been using them for approximately 5 years, and we've had Ken Klicka acting for a portion of that time as our Chief Information Officer. Since we have promoted Darren Rosnick into the Chief Technology Officer role, we've kind of scaled this contract back somewhat, but we are still using those services, and we use them for expertise in IT issues, strategic planning, and those types of things. So we would like to continue this contract for an additional year. I believe this has 1-year renewals in it, so we can renew year after year. But we would like to continue this. But as I said, we've scaled this back somewhat since we've moved Darren into the role of Chief Technology Officer.
Okay, very good. Any questions or comments? I'm going to ask, if you're in the chambers, you'll have to verbally get my attention because I'm on gallery view here. So any questions or comments?
Mr. Chair?
Yes, Mr. Malley.
Thank you, Mr. Chair. Thank you, Mr. Fricker. Would you be able to share like the draft scope of services?
Yes, we could. Yeah, so we do have a draft scope, and we'll email that out to council tonight.
Okay, and then when does the current contract expire?
I believe it is already expired, so
Okay.
it was earlier this year, within a month or two prior to this, so.
Okay,
Yeah.
so this would be an extension until next summer?
This would be an extension until next summer, correct?
Okay, and then when you say the role has been scaled back, can you kind of describe that a little bit more?
So I think Darren or Ken was really acting as the CIO for a good portion of that. A lot of the decisions were going through him. He was advising us. I know he's been advising us on several different issues, some with the courts, some with the case management system they're putting in, with our network infrastructure, all those different areas. And we've slowly taken a lot of those tasks on ourselves now. So his role now will be more of a kind of a strategic planning type role, as opposed to, kind of the day-to-day approvals of the operations of the division.
Okay. Well, I appreciate the information, and yeah, if you could share the draft contract and the draft scope, that'd be helpful.
Yep.
Okay, thank you. Mr. Malley, any other questions or comments? Mr. Fricker, consent okay?
Yes.
I just want to make a note that this is the last
Yeah, that's a
meeting.
good point. This is, am I correct? This is the last, yeah, so I guess we would like to pass, given that the recess is coming up. Yeah.
Mr. Chair, I would make a motion for suspension of the rules with a favorable report.
Second?
A motion and a second. All in favor, let me know by saying aye.
Aye.
Opposed? Okay, then we will put that through this evening. And pardon me, this is the last time we'll be meeting for a month, so. Okay, our next item is an ordinance authorizing the mayor or his designee to enter into a contracts without the formality of advertising for bids with governmentjobs.com Incorporated for the purchase of NeoGov human resources software for the Department of Human Resources and declaring an emergency.
Thank you, Mr. Chairman. So this is a renewal of our NeoGov. It's really a subscription-based online platform that we use for a wide variety of HR-related tasks and services. I'll let Yamini Adkins, our Human Resources Manager, give an update on what that software is for, but this is something we've been using for a number of years, and this is a renewal of that software.
Hello, good afternoon. I just wanted to reiterate, it is something that NeoGov is actually a software that predates the current Workday software. If you recall, a few years back, we had purchased Workday as the central primary software, HRIS system for the entire city. However, there were certain features in the NeoGov that we had not fully integrated into the Workday. So our goal is to ultimately do that, but for at least for the next year, there are still features in there that are geared towards government type jobs that we still have to maintain. So we need this for at least for another year.
Thank you. Questions or comments? You're on my screen here. Am I missing anyone, Ms. Viviano?
I don't see any hands raised here in chambers.
Okay, we want suspension of the rules on this as well, on for month.
We would.
Okay. If there are no questions, do I have a motion?
So moved.
Second.
We have a motion second for suspension of the rules. All in favor, please let me know by saying aye.
Aye.
Are there any opposed? Okay, excellent, thank you. Okay, we have an ordinance authorizing the mayor or his designee to enter into a contract without formality of advertising for bids with RIP Medical Debt for the purchase of services to assist residents in the city to obtain relief from medical debts and declaring an emergency.
Thank you, Mr. Chairman. So this is the medical debt relief program that we talked about during budget hearings. If you remember at the time, we passed an ordinance at that time that allowed us to to procure these services after the formality of advertising for bids. So we passed an ordinance back, I believe in March, that allowed for that. Since that time, we've been looking at this program, and based on what we've been seeing from many of our peer cities around, really around the country, both in Ohio and in other states. So we've seen, for instance, Cook County, Illinois is one of probably the largest program in the country, but we've also seen Lucas County in Ohio, the city of Cleveland, the city of Cincinnati is currently looking at this. All of those entities have engaged with RIP Medical Debt to perform this service of having the medical debt relief program. So we've decided that it's in our best interest to just move forward with RIP Medical Debt with this ordinance and allow them to perform this service. So the way this, I'm sorry, go ahead.
No, please proceed.
Okay, so the way that this program is going to work, so one thing I want to say up front, and I know we've had a number of discussions here in council about how this program will work. This is not something that our individual citizens will sign up for or apply for. So I just want to be clear about that. This is something that once RIP is engaged to perform this program, they will work with the hospitals and they will seek out to purchase this medical debt that exists out there. They will buy this debt basically in tranches and then invoice the city according to the $500,000 that we have outlined for this program. They will invoice the city as they purchase this debt from the city. So this is not something, I want to say that again, this is not something that citizens apply for. This is all handled by RIP Medical Debt. They will purchase this debt from the hospitals and then retire that debt. The individual citizens will receive notification once their debt has been retired in the form, I believe it's just mailed correspondence to their, to their home, indicating that that debt has been bought, the amount of debt and who it was retired from. So the citizens will get that information as that debt is retired. The city will, both on a quarterly and annual basis, receive reporting back from RIP in terms of the beneficiaries of this medical debt purchases. So we won't get names per se, but we will get income and demographic information regarding who the beneficiaries of this program are. So, and then the city can set the parameters in terms of, obviously we're targeting this towards Akron citizens. So we're able to basically provide, and it goes down to the zip code +4 designation of each person's address to make sure that Akron citizens are benefiting from this. So we will provide, through our GIS system, a list to RIP of all of our zip code +4 listings so that they can target those citizens for the debt relief. And with that, I'm happy to answer any questions.
First question I have, when they purchase the debt from the hospital, is that at a discounted rate?
It is, yeah.
We know what that is, 20%?
So I think it can, I don't think it's that specific, it can vary. This is all a process that they go through with the hospitals. They've made it very clear, and we've had some discussions with them, that, they won't know the full extent of what debt is out there for Akron citizens until they actually work with the hospitals to see what that debt portfolio is. So that's all part of the process in terms of what that multiplier factor is, in terms of, what percentage of the debt, per dollar they're purchasing that for.
I know I'm just sitting here as a council person. I'm sure my other 12 counterparts would have the same question as far as how selection is made and how, I appreciate you told us that this is not something that citizens do not sign up for themselves, but along the line somewhere, there's decisions made as to who has debt forgiven, how that decision will be made, and what the criteria is going to be. Is there a place we can look to try to find those answers?
So the primary criteria is they will look at a percentage of household income above the federal poverty level. So there will be parameters around that, and then also parameters around the percentage of their income, the debt's percentage of their total income. So they'll look at those factors and determine who is eligible.
Okay, very good. Okay, coming to questions now. I see Ms. Moten, please.
Thank you, Mr. Chair. My question has to do with, if a family has medical debt, let's say at all three of the major hospitals, do they come together and look at all of the debt, or just that individual hospitals would do it separately?
So my understanding is it would be done individually. So they will buy this debt, as I said, basically in tranches from each of the individual hospitals. So I believe that based on what I was told on the call is that so if someone did have debt at all three hospitals, I think that debt would be, basically written off in three separate installments, because they would be dealing with each of the hospital systems individually.
Okay. So, and I see Councilwoman Holland's hand, so I'm sure she has more information. Just ask another question real quickly. It's not that all the debt will be cleared, is that correct? It's like all the debt not only your debt would be cleared, a percentage of it would be cleared, and the family then would be left with a smaller percentage to clear? Because it doesn't sound like they're going to be able to pay all of it.
I believe that has yet to be determined, and it all depends on what the universe of debt that is out there is. Okay. So I think that's unclear at this point as to what percentage of the total debt that's out there will be cleared.
Okay. Thank you, Mr. Chair. Sounds like Councilwoman Holland may have some more information.
Okay, thank you. Yes, Councilwoman Holland?
Thank you so much. So I would encourage my colleagues to refer back to the original legislation from last winter authorizing engagement in a medical debt relief program. And the legislation and everything that's happened since then has proceeded from the RIP medical debt model. That model, which was developed to comply with the expectations and the requirements of the American Rescue Plan Act Treasury guidelines, establishes that there is actually an income qualification that applies. So this isn't just anybody, okay? Qualifying recipients of this help must be at or below 400% of the poverty line. And to give you an illustration, for a family of 4, that household income is about $111,000 a year. Then there is a companion qualifying test, which is that the medical debt burden for the individual or family must be at or above 5% of the annualized income. So this isn't just like, $6 here and $19 here, and, there is, a cap beyond which, those who earn a whole lot more would not receive this help. It's my understanding that this would not be segregated out or limited to one provider here or one provider there. Now, if there's a difference in how the program's being administered right now than how it was described to me as recently as a few months ago, then, that may be the case. But my understanding is that total medical debt will be aggregated for these purposes. So, but I think the most important thing that I really wanted to say today is that lest we think that this is brand new, we did this last winter, and then we did this by including an amount of money, setting it aside in our operating budget. And I also want to say thank you that we finally have this ball rolling, and I want to do so on behalf of Juanita and Jen and Robert and Michael and so many people who've reached out to say, is this ever going to happen? And am I going to get this help? Again, as we discussed at great length last winter around this legislation, this is one of the biggest causes of becoming unhoused, becoming divorced, becoming bankrupt, and sliding into depression and substance abuse issues. So this is a very, very big deal. For those who are watching and wonder what next, as Mr. Fricker points out, you don't have to do anything. The way that RIP Medical Debt has constructed its plan, there is a data sorting that happens that's sensitive to individuals' medical privacy. So nobody's going to be, sorting through your personal information. Nobody's going to be sorting through your personal income data. This is information that's been compiled and then is sanitized for your privacy. You will be notified if you are somebody who fits within the qualifying criteria. So, thank you.
Thank you, Ms. Holland. I'm looking for any other hands, and I believe it's Sarah. Is that you? I saw a hand.
Yes, it is. Thanks, Mike.
Okay, thank you.
Just briefly, when speaking to them about the criteria and the parameters, I think that's really important for us to understand, at least for me. I know that we have all these HIPAA laws, but how are they going to be able to target someone's income? Because a lot of times when you're going into the hospital and they're taking your information, no one is ever asking about your income. So how do they track whether someone is under the poverty level versus someone who may be making over $100,000 when they start clearing the debt? Because that's the only part about the medical debt relief that is always concerning me, is how are they really tracking whose debt they're going to pay, and how do we as a city know what parameters they're actually going to be targeting when this money is distributed to the hospitals?
So I don't know that I can answer that exactly, other than that is the platform that the program works on. They must have some way that they can obtain that income information, because it is a key part of the program, as Councilwoman Holland said, right? It's 400% of the federal poverty level, and then the debt has to be over 5% of your household income level. So
Yeah,
they must have some mechanism for pulling that information.
Yeah, just trying to figure out how they do that when you don't sign up, they pay this debt, but how do they know who's below it? Because I was my brother's POA, and they've never once asked his income when I've taken him to the doctor.
We will ask RIP for their process and share that with council
Okay.
in addition to the contract once we negotiate the terms.
Okay, all right, thank you.
Thank you. Any other questions or comments? Looking for hands. Mr. Malley?
Mr. Chair, I'd make a motion for suspension of the rules with a favorable report.
Second.
We have a motion and a second. All in favor, please let it be known by saying aye.
Aye.
Any opposed? Okay, very good. And I know one thing I did want to ask Mr. Fricker, timeline. What's it look like timeline-wise for this?
So my understanding is, basically, once the contract is entered into, we'll have to go through, there are some legal things to work through with the contract. Once that gets started, they can start meeting with the hospitals, to basically make arrangements to look at those debt portfolios. So what we were told is that basically it's potentially a 3 to 6 month process for them to kind of look at that information.
Okay, thank you. Thanks very much. Finally, our fourth item is an ordinance authorizing the mayor or his designee to enter into a contract or contracts without the formality of advertising for bids with Summit Education Initiative for the purchase of services to assess and improve the efficacy of the city's violence intervention and prevention programs undertaken under the American Rescue Plan Act and declaring an emergency.
Hello, Mr. Chairman. This is Tamika Rose in the Mayor's Office. I wanted to inform you, because you are on the screen, that we do have Mr. David James and Allison here to talk about what they will be doing to evaluate all of those individual grantees that have received funding from our American Rescue Plan Act dollars for violence intervention and prevention. This will be a 4-year, well, it's actually 5 years, but the contract here is $100,000 renewable upon for 4 years until the ARPA dollars are expired, to help those individual programs figure out the data that is needed so that they can sustain their programs after the funds are exhausted. So this is not just, this is more of a technical assistance for those individual programs, in addition to give us data about what has been done to reduce violence in our community. I will turn it over to Danico and Mr. James and Allison if they would like to explain a little bit more, because they've been involved in this in more detail than I have.
Good afternoon, Mr. Chair, members of the committee. So Summit Education Initiative, our primary goal, of course, is educational attainment. And through a lot of the work that we participated in with the city regarding the VIP program, we also know there's an intersection between youth violence and their education. And so one of the things that we're charged of doing in the community is also evaluating various programs. So I have with me Dr. Allison Drinkard, who is our Senior Director of Research and Evaluation, who will explain her logic model and the services that we're going to be providing over the next 4 years.
Good afternoon, everyone. So program evaluation is something that I have a lot of experience in. I've been conducting community multi-site program evaluation for about 25 years. And there are 2 primary parts to a program evaluation. There's the process evaluation and an outcome evaluation. And the process evaluation basically looks at what happened after there was an allocation of resources, how the programs worked, and what the results were. And the logic model is the primary tool that we use to conduct a process evaluation. The Center for Disease Control has a suite of tools under their program called Veto Violence, and The strategic plan is being evaluated according and applying those tools from the CDC. The logic model shows how resources or inputs result in activities of the programs and services that results in outputs, and outputs are those administrative measures, counts of things, and finally outcomes, which is what shows what impact this program has had on the community. And the logic models are part of the site visits that we're conducting with each organization. We have the mayor's marketing and communication team come with us to take some photographs, some videography. I conduct an interview for about an hour with each of the leaders of the organization, and together we work on a logic model. And the logic models are sort of vamped ahead of time. So we look at their VIP application and have a rough outline. We take this to the site visit and allow them to respond and help us to better understand what all of those elements are. This is not a one and done type of exercise. This is something that will be continually assessed over time. And it is a primary tool for future sustainability of these organizations too. This is something that funders, large and small, look for, and it helps to show the ways that these programs are effective and why. So that's basically, in a nutshell, the process evaluation. As part of preparing for the outcome evaluation, we are looking at certainly crime statistics, but also we do not want the success of this program to be dependent on crime statistics, and we've identified some national measures around particularly the 40 developmental assets to serve as another tool to look at outcomes, how the strategic plan is increasing internal and external assets for youth. Okay. And as we are going through the interview and the logic models, we're starting to get a better idea of the ways that these organizations believe their services are impacting youth, and that's serving as the foundation for our outcome measurement down the road. Do you have any questions for me?
Thank you. I do see Ms. Amobian. I do see Ms. Amobian's hand.
Thank you, Mr. Chair. I've heard what you said. I think I heard it clearly. I still don't understand how, and I'm assuming that there's no background at Summit Education Initiative in terms of doing anything with youth violence in particular. And I realize you're talking about the evaluation process. Am I correct in assuming that you've not done any work like this before?
This is really evaluation work, and Summit Education Initiative has an extensive background in performing evaluations, particularly for our funded programs across Summit County. Funded programs from whether it's Akron Community Foundation, GAR Foundation, or United Way of Summit Medina. When they provide funds to organizations, one of their requirements is to have SEI do the evaluation so they can determine the efficacy of their grant making. That process is very similar to these funded programs. In fact, some of the organizations that are being funded through this program have been funded by GAR or Akron Community Foundation or United Way, and we've done evaluations on their different aspects, particularly some of their summer programs.
Yeah, but you're talking about the efficacy of how they're progressing educationally. Am I correct in what you have done?
Not necessarily.
Does this have a lot to do with behaviors and what kinds of programs and things we need to put in place, what kind of services we need to help curb these behaviors? I mean, you're talking about a lot of things that, and I don't know if there's any program or any evaluation tool anywhere in the country that's going to be prepared to help us, but what you have done in the past, I believe, if my memory serves me correctly, is that your your evaluations have focused on how well children are progressing educationally?
For the different funded programs that we performed evaluations on, a lot of the grant-making organizations have had other metrics such as the time that's being served and whether that has changed behavior. Some of that is included in the evaluations that we have done historically in this community. And we have a long reputation of doing that.
And Councilwoman, I would just like to add that I started my career in youth violence prevention. My first position as a community program evaluator was for Cuyahoga County, and this was for the Strengthening Communities for Youth program. It was a longitudinal evaluation funded by the Substance Abuse and Mental Health Services Association, and it served youth in the detention center who had co-occurring substance abuse and mental health disorders. So my background is what is, I'm bringing this background into the evaluation of the VIP strategic plan. And we have identified best practices. We are paying attention to the evidence base that all of the organizations are applying, and it is part of the evaluation strategy to align all of their services and activities with those best practices and evidence.
Now, when you said longitudinal, how long was your study in the area you came from?
It was 5 years, and
okay.
Yep.
Let me ask you this. Now, you're talking about $400,000, and you're talking about over 4 years. Do we have that time to, because this money has to be spent by 2026, is that correct?
Yes, that is correct, and we do have that time for this year until 2026, so it'll be every year. So 2023, 2024, 2025, 2026.
So are we to get reports or anything every year? How is this going to work? How do we know if we're on the right path in terms of getting information to help us justify what we're doing or tweak it or whatever we need to do?
Quarterly? That is a great point, and we have planned for quarterly updates to the mayor's office and the council if desired, and annual evaluation reports culminating in a final report with a suite of recommendations.
And also I'll add that we do have a
Excuse me, I'm not sure that your microphone is on. Thank you.
This is Danico. I just want to add also, the SEI team and I, we meet monthly as well to just discuss where we're at and where we're moving forward.
Thank you very much, Mr. Chair.
Mr. Chair.
Okay, thank you, Mr. Malik. Sorry about that.
Thank you, Mr. Chair. And thank you to everyone presenting on this. So I appreciate the presentation. Ms. Rose, can you walk me through the timeline? So we would begin evaluations when of the 2023 cycle of grants?
So they've already began evaluating, so that she's already gone to do site visits and everything else. We had started doing these contracts, but with the different changes of, you know, the budget bill and everything else.
In Section 56.
So we've been working on the contract, but we were trying to get the language together, but she's already started meeting with the individual programs.
Okay. When did that start?
We began, about 2 weeks ago, two to 3 weeks ago, we conducted our first site visit with the Williams Challenge.
Yes. However, we have been meeting with SEI for
since February,
yeah.
January, February of this year.
Yes.
Okay, but essentially, there's like 6 months worth of work that's already been done.
Yes, and with her putting together the logic model and all of those different things, yes, she has been putting that together. She's been working on the strategic plan with Danico and Dr. Ellie McWilliams-Woods. So she's been working with the team behind the scenes
Okay.
for over 6 months.
Is the contract and the scope of services available?
Yes, we can send that to you.
Okay.
We
Can
haven't
you-
signed it yet, though.
Okay, can you send it this afternoon?
Yes.
Okay. Yeah, I think it would definitely be appreciated. I know from my part, you know, I definitely appreciate the work that's been done, but I think the evaluation is an important part. I, you know, wish we had more information about this sooner, but I appreciate that, you know, this all has unfolded in a certain way. I have a lot of respect for the work that SEI does in terms of evaluation. I guess the one point of concern I do have is that if we're talking about a 4-year contract, you know, that is a pretty extensive period of time to commit ourselves to this particular thing. And so it sounds to me like this should be, and it sounds like the contract is structured, so that's why I want to look at it. It sounds like it is structured as 1 year with a renewable option, which may make sense.
Yes.
Is this fully funded through ARPA?
Yes.
Okay. Okay. Okay, well, thank you. That's all I have for now. I imagine some of my colleagues also have questions.
Mr. Chair, Councilman Lombardo has his hand raised.
Councilman Lombardo.
Thank you. Just want to be clear, this is 400,000 a year or over 4 years?
Over 4 years, so it's 100,000 per year.
Okay, thank you.
Yes, Ms. Hall.
Thank you, Mr. Chair, and thank you for the presentation. I have a related question to what Councilman Malik was getting at. Can you confirm that this is a $100,000 annual contract, renewable year by year?
Yes, we can. It's in the contract. We will send you the language of the contract.
Very good. And I had another question, and you know, I love this seat in the horseshoe, but it gets a little awkward sometimes. Dr. Drinkard, this is for you.
Yes.
You indicated that there are some 40 criteria that you are looking at other than the kind of, I guess, cold or not very nuanced, you know, is there more violence, is there less violence type data. And without keeping us all here for you to go through each of the 40,
Yes.
you did reference specifically something about whether internal and external assets are able to be retained. If you could explain that just a little bit, what is an internal and external asset, and also what other things, and I think we sort of isolated this a little bit in response to some other questions. We're not necessarily looking at educational impact. That's not what we're doing here, though I understand that is part of your organizational mission. What else are we looking at? Could you flesh that out just a little bit?
Sure.
Thank you.
When you take a look at the design of the VIP strategic plan and you think about why is a strategic plan like this going to have an impact on youth violence, there oftentimes are very long-term effects of these types of services. And in the more immediate term, the reason why violence declines is because developmental assets are increased. And developmental assets are something that have been studied for decades. There's national proof, there's standardized measures that look at something like an internal asset and external assets. So internal assets are things like sense of self, peaceful conflict resolution. External assets are things like I have somebody that I can rely on or go to if I'm in trouble. And so taking that developmental assets approach, which is aligned with the strategic plan because of its heavy emphasis on mentoring and recreational and out of school time, means that we can measure change in youth over time based on those assets, and predicting that an increase in assets is going to reduce things like fighting, aggressive behavior, violence in the long run, but also leads them to thriving in life, which means that they're going to improve in things like educational aspirations.
Thank you so much. And Mr. Chair, if you would indulge me, I had just one additional question for the team about the contract.
Thank you, please.
So if I'm to understand that the proposal is for a renewable contract with a total value of $400,000 over a period of 4 years, this suggests to me, and I want you to correct me if I've got this wrong, this suggests to me then that all of the existing contracting organizations would be presumptively on board and providing these services for the next 4 years. Is that right? Are we studying just a particular point in time, or do you follow what I'm saying?
Somewhat follow what you're saying. Similar to what we're highlighting within SEI, each of our round 1, 2, and 3 grantees have a contract agreement for 1 year. Right. And many, especially our round 1 grantees, has up to 3-year renewable. Mm-hmm. So again, one of the conversation points that we're looking at exploring is how to look at some of these evidence-based practices that each of the grantees are demonstrating to determine who's going to be renewed in the upcoming years.
Very good, thank you. And you know, I think the hour is getting late-ish for all of us, so that's exactly what I was trying to get at. Given that we are talking about 1-year organizational contracts, you know, are we getting into a relationship potentially with Summit Education Initiative that is suggestive that that plan to stay in 1-year relationships with these providers has somehow now changed? You understood me completely. Thank you.
Okay, looking around to see if there's any other questions.
Mr. Chair?
Yeah, I do have one question before we proceed. How many, obviously, you know, we have a piece before us here. Unlike our arrangement with Guide House is just keeping us out of trouble. We don't spend the money wrong. I understand that's not what's happening here. But how many millions of dollars of program is it that you're actually going to be overseeing? I'm just trying to put to measure the cost together. In other words, we have under the ARPA plan, we have services dealing with violence prevention programs. What is the cost of those programs to the city compared to the cost that we'll be expending to evaluate the effectiveness of those programs?
Mr. Chairman, we will have to get back to you on that to get the exact number.
Okay, and I'm just asking, like, to get a cost of.
We have the number. We just, I don't want to give you a guesstimate that out of my head. Okay. Thank you.
Mr. Chair, Councilman Fusco has his hand raised here in chambers.
Okay, Mr. Fusco?
Yes, thank you. I appreciate the debate. I appreciate all the questions and the exchange here. Just feels like there's a lot of firepower. SEI has a reputation in town that is pretty impeccable, really, in what they've been able to do over the years in terms of our students, our kids. Whenever we pass the ARPA funding, many of us, if not all of us on this council, were concerned about measurements, about effectiveness, and about sustainability. And it sounds like this is what this is about. To me, that's what it sounds like. I would stand up in favor of this proposal here. Again, I can't. Isn't part of the ARPA funding that we have to provide for the federal government outcomes?
Yes, that is correct.
Okay, thank you. And it seems as though this is going to be able to give us that, if I understand it correctly, everything that I've heard today and what I've read. So with that, again, I would just stand in favor of this. Thanks.
Thank you.
Thank you, Mr. Fusco. Now I have a few other individuals. I'd like to come to Councilman Neal next.
Thank you, Mr. Chairman. Well, I'll start with the question asked by my colleague, Councilman Fusco. If you can provide for us, please, those metrics that you will be using to determine effectiveness, that right there would be helpful, so that council and potentially others in the community can make sure that we incorporate them as we evaluate the things that we do. One of my questions is, I'd like to know if, I know you're evaluating the groups, but because this is a systemic problem, and these groups do not have the capacity to address it by themselves, are you also evaluating all of us that are part of this youth that have a concern or have a role to play in addressing youth violence? Meaning, how are you participating in helping to look at how council, the school board, the juvenile court system, the administration, all those that are engaged with youth, the healthcare industry, how are we communicating to track the youth that are under our care? Is that something that falls under your jurisdiction?
Thank you for your questions. I will say that we are taking, it's a both and approach. And so we are evaluating the city's approach broadly. So Danico and Tamika are going through the same process that the VIP grantees are going through with the development of the logic model. And there are many cross-sector partnerships, as you mentioned, juvenile court. There is partnerships with education. There's partnerships with Summit County Public Health. There are so many organizations and agencies involved, and they are all part of what is being collected as evidence about what happened with the allocation of these funds towards the reduction of violence. And so when we think about the outcomes, to your first part of the question, there's a series of crimes that are going to be tracked through the APD. Those are violent crimes, crimes related to gun violence. Would you like me to read the list? Yes? Assault, felonious or aggravated assault, discharge of a firearm, robbery and aggravated robbery, weapon law violations, homicides, murder, aggravated murder, voluntary manslaughter, and involuntary manslaughter. And then in addition to that, through the use of the logic models and our method of evaluating each organization, we recognize that there isn't necessarily a one-size-fits-all outcome for all of the organizations. There's 40 different, mostly grassroots organizations who are all kind of approaching this from a different perspective, to your point. And so we are building that evidence. We are collecting the outputs and outcomes by organization. And as we go along, we'll be able to identify the themes of outcomes that we can evaluate across all 40 organizations, all the way up to how things are being coordinated at the mayor's office.
Mr. Neal, I can personally vouch for the work Danico does and the networks he has created with his position. The schools, the hospitals. He met with the hospital today. You know, high needs resources. So having Danico here to create these networks, to keep that communication going, has proved to be invaluable for this particular issue as well.
I appreciate that, and please understand, I am not discrediting the work being done by anyone. But the reality is, we had another youth shot and killed last night. We know that if the youth has been shot, that they're apt to be either shot again or to shoot someone. Are we using that data to create support systems around these youth? I have to say no. And so, again, what I'm saying is so that we can create the synergy between council, the administration, law enforcement, the school system. School's getting ready to start. Every school is going to be beating the bushes to get their enrollment count because they want to get the dollars that come with each one of our children. Do we have a system in place to where if a student isn't registered in school, and it's more difficult now because are they in public school, are they in charter school, are they in private school, are the different school systems communicating so that no youth falls through the cracks? And if a youth is not enrolled in one of those schools, where is our support system to make sure that we put wraparound support around those children? Like I'm saying, Ms. Rose told us, and it was an honest answer, these groups aren't going to curb youth gun violence. They don't have the capacity. It takes all of us. So what I'm asking, and this may be unfair for some of your group, because it may, as Councilwoman Amobi was leading to, this is new territory for you. I understand your experience, but for the organization. Because if we were really doing the analysis, we would even be looking at how has United Way been funding groups? And has that been effective? As great as United Way is, I'd say no, because we have the problem. And so it takes all of us to take a step back and analyze how we are working together collectively to address this issue. And if I understand my colleagues right, we don't have time, we don't have 4 years. So we got to make sure with this investment that it is creating the synergy between all of us to make sure that we provide the communication to address this issue. And so I won't take any more time, but I would like to see, because a lot of things you were mentioning were the different charges, but children are getting ready to go to school, and you know what? Some of them are going to be terrified because they know sitting in their classroom is someone who shot and killed somebody. And we've got to understand that. And until we do, we've got to understand we're talking about systemic problems, and it's not a criticism, but it's just a reality that the systemic approach that we have used with our different systems has holes, and our children are falling through them. So I would like to see, so that council could take a look at it, what measures you're using to evaluate, and to make sure that there's equitable investment, because we may not have to invest as heavy in some areas as we do in others. That would be very helpful. Thank you.
All right, thank you. I'll kind of go in order that I saw hands come up here. Ms. Amobi, you'd be next, and then there's another hand on council screen. Thank you.
You can bypass me, Mr. Chair. Thank you.
Okay, Ms. Vivian, is there a hand in the chambers that I'm missing?
There are a few here, so I'm going to go in order that I saw. I saw Councilwoman Mosley, Councilwoman Holland, and Gert Wilms.
Okay, thank you.
And Councilman Malik.
Thank you, Councilman Freeman. Don't be offended by what I'm about to say, because I don't mean to be offensive, but it seems like we are shelling out a lot of money for individuals to provide oversight of funding, to give us data that most of us already get from the APD dashboard, or we were just sent data from Chief Milet today. I appreciate the work that has been done behind the scenes from your organization before coming to us. I appreciate the work that Danico does. He's been out here doing this work prior to even coming to the city, so this is not to offend you. but we have some real issues in these neighborhoods that have yet to be addressed. We have a lot of people who are given funding that I've never even seen in these neighborhoods, and we're given quite a bit of money. And I know the ward that I represent, we are experiencing gun violence at a level that is concerning. It is concerning. I just had a shootout on Alexander Street, yet 44306 couldn't even get ring cameras. But we have $400,000 to give to someone when I have my elderly residents afraid to even sit on their porches. I am concerned. We have money for everything else except for the people who really need it. I won't support this because it's not supporting the ward that I represent. It's not. I'm getting calls every single day about a gun shot, about people on the ground, people getting shot from stray bullets. I had a girl found up in a rosemary in the bushes dead a few weeks ago. It's not touching my ward, and my ward is being affected. A whole bunch of people got money, and I ain't seen them over in my ward, but a lot of people got a lot of money, and now we got more money. I've got a sports program with over 6 teams in it, people taking care of our kids, almost 2,000 kids. And I'm still begging for money to help these people out. But we found $400,000.
Yes.
I'm very upset and I'm concerned. I won't support it, sorry.
Thank you. Let's go, I'm not sure what the order was. Ms. Holland?
Thank you, Mr. Chair. Just this morning, New York Magazine published a very compelling story on the ironically short recorded history of the idea of post-traumatic stress in America, covering the work of the noted psychiatrist Bessel van der Kolk. This article is, I strongly recommend it, and you may ask, why is she talking about a magazine article? Because I think that there is some potential here for us to get where we need to be, and I really, really look forward to getting a copy of the contract and a better understanding of the scope of the work. I've exchanged some messages with Danico, and I'm looking forward to our conversation this week. Trauma is, I think, the word that we can all agree on when we're talking about what we're going to do about violence in general and what we need to figure out for the city of Akron specifically, because this is our home. It strikes me that Summit Education Initiative is eminently qualified to help us understand what trauma has impacted whom, that there are tools for both screening and measuring. You know, something, and we always seem so pressed for time when we are talking about the most important things. Anybody else notice that? We're always rushing when we're talking about the most important things. I would really love to know more about sample size for our exploration of, you know, where we are with internal and external assets, just for example. But one of the things that I had a conversation about with a woman who resides in Ward 1, she's a learned professional. She holds a PhD in a social science. Just had this conversation over the weekend. What if we put ourselves in a position to screen every resident in the city of Akron for trauma? What if we could identify those who have been most significantly impacted? Councilman Neal just made an excellent point, and statistics bear this out, that a child whose friend or classmate has been, taken down by gun violence is him or herself more likely to be involved in further violence. This is so counterintuitive, and yet the data is there. It shows us this. So what does any of this have to do with the matter at hand? This. We're getting down to, the last several dollars of our ARPA allocation without belaboring how we got here in terms of, decision-making about spending and whatnot. I think it's important that if we're gonna look at measuring the impact of these programs, which have not been cheap, okay, then let's make sure that we get it right. The contract is focused and is looking at the right things. And if there are those who feel that we need to be looking at something else or something differently, I think we should entertain that. I'm not against performance measures. I think they're a good idea, especially when so much money has been put towards this. But I'm going to end my going on with this question. Is this different than the kind of performance measurement or oversight that we're getting from Guidehouse already, that we're already paying for?
Yes, it is different.
Okay. Would you care to elaborate?
It's different in the fact that this is actually giving them, the logic model is specific to their organization. It is not cookie cutter. Am I correct in that, Dr. Tree?
Yes.
Okay. And what Guidehouse has given them is on their back office kind of finance, how to do an invoice, how to keep their books together, how to get the compliance in order, conflict of interest documents, like basically setting up their organization to be operable. This is actually helping them to get grants in the future to sustain their organization after the infusion of these ARPA dollars, which I know a lot of you all were concerned about in the beginning, is making sure that they were going to be able to sustain themselves after the ARPA dollars had been expended. So that's how this is different in terms of the technical assistance.
Okay, so let me make sure I understand. So having given these organizations a one-year, $100,000 operating cost boost, we're now proposing to spend an additional amount of money to better position them to get some more operating funds? Is that what we're doing?
From national funders, so
Okay.
other philanthropic organizations to help them sustain. It will not be coming from the city,
Okay.
unless the next administration sees fit.
Okay, thank you.
Mr. Chair, you're muted.
I believe Mr. Malik was next, please.
I know Ms. Williams wanted to speak, so.
Mine is pretty brief. One, just hearing the conversation from my old career at the city, I definitely learned at a young age punishment was not something we could do to get ourselves out of a problem with youth violence. We really have to work on prevention. And if we're not all talking, communicating, and really digesting this information, like Mr. Neal advised, we're not solving the problem. We are offering a solution here that is novel, that is something for us to take a look at with a funding opportunity that never existed before. So I definitely appreciate the feedback. In addition to that feedback, I know Danico has reached out repeatedly to members of council to sit down with a one-on-one to go over the strategic plan. If you have not scheduled, I would ask you to follow up on that. It is a wonderful opportunity for great suggestions, great feedback from what you're hearing in your community. So if you've not had a chance to meet Danico one-on-one to talk about that updated strategic plan, I would absolutely ask you to do that.
And Councilman Freeman, I would just like to add on to Ms. Wilms' comment is that in addition to looking at the different funded programs, SEI is also helping us evaluate the strategic plan as well to make sure that the strategic plan is doing exactly what it stated that it would do. So it's not just the funded programs that, that we have.
Yeah, and just to shed light on that, one of the barriers in the 2019 strategic plan was the lack of implementation, and particularly when it came to the strategic plan implementation around is it going to work or not, there was not an identified funding resource to support that. So with, the American Rescue Plan Act dollars, it really assisted in not only reducing the barrier of the funding to support the 8 approaches, but also reducing the barrier of having an evaluator to determine whether the work is impacting our community in a positive way or not. As Gert mentioned, I'm excited to schedule some time to meet with you all individually to talk about the strategic plan, particularly around our pending initiative, which Council Member Mosley, you mentioned around sports, which is a pending initiative, and also many have talked about addressing those young men and young women who are doing the crimes as it relates to having guns and shooting people and committing homicides. That's really what we want to work with the community and work with you all as it relates to Hobby. Hobby focuses on that targeted 190 to 200 young individuals in our community that are doing the crime. So as Gert mentioned, excited. Well, thank you for those who have scheduled some time. Many have already arranged time in the upcoming week or two to schedule to meet with me to talk about it. I'm definitely interested in hearing from a council member standpoint what we are not doing well to offset some of those issues moving forward.
Thank you. I don't want to leave anybody out of the loop here. Do we have anybody else in chambers
Yes.
wanting to speak?
Yes, Mr. Malik has his hand raised here in chambers.
Thank you, Mr. Malik.
Thank you, Mr. Chair. I just wanted to make a motion for time. Just to be really clear, I think we do need to look at the contract and the scope of services. I'm sure that we as a city will pay for our bills and pay for work that has been done, and I think that SCI doing this evaluation makes sense, as Councilwoman Holland says. But part of the reason for wanting to remove Section 56 out of the budget was so that we do have a meaningful opportunity to, look at things that come before us like this, especially when we're looking at a 4-year commitment. And the elephant in the room is obviously that that commits us into another administration. So that would be my request, that we take time and that we look at approving this in early September when we return.
I second that, Mr. Chair, but I see Mr. Neal has his hand up, Mr. Chair.
Yes, there's been a motion, a second, and we'll discuss the motion. Now, Mr. Neal.
Thank you, Mr. Chair. I just want to say, as we go through this, if SCI can help educate us all on how to, at some point, do the evaluation. And when I say all, I mean, as Ms. Williams mentioned, all of us that are engaged in this work, so that we can, and I don't want this to sound bad, but in some cases put them out of work as far as doing this work. And this is what I mean. These dollars that are coming in from the ARPA money are to address systemic problems, meaning things that have been here for a long time. We have to be equipped when the money is gone to be able to still address these issues and shift the tide. And I want to use this as an example. Many folks know about Project Ujima, and when there is a major issue, Project Ujima still comes out and helps facilitate service. But because of many who have gone through the Ujima process and understand the circle process, many now engage in circle discussions, and they don't need the contract with Project Ujima. It has become a part of the community's culture. This evaluation process, which we all hope will be a key component to help us be able to measure our processes and progress, needs to become a part of our culture, so that we don't have to invest money here any longer, because it's just the way we do. It's a new system that replaces the old system and puts in a new system, so that we can invest this money in other areas, because this is a huge issue. So that's all I'm asking, is that as SCI goes through this process of evaluation, that there be a part of instructions so that we all make this a part of our process of evaluating our work so that there's uniformity in our approach.
Thank you, Mr. Neal. Was there anybody else that wished to speak? We do have a motion that has been seconded. Any further comments?
Yeah, I'll just comment, Councilmember Neal, thanks for that comment, and actually, that's kind of the work that we're funding Project Ujima to do. Project Ujima is one of our funded partners to have community conversations similar to what you're discussing and articulating. That's also outlined in our strategic plan to make sure that on bi-monthly meetings and quarterly meetings, we have community conversations facilitated by Project Ujima.
Thank you. I don't see any other hands. We have a motion for time and it was seconded. All those in favor of time, please let me know by saying aye.
Aye.
Any opposed? Okay, we'll place this item on our regular agenda, and we are adjourned 4:11 p.m. Thank you.
That is the final committee meeting of the day. Council will meet at 7 p.m. tonight. Thank you.